1. The anterior fontanelle in an infant typically closes by 18 months of age. True or false? Answer: true. Rationale: the anterior fontanelle typically closes between 12 and 18 months as part of normal cranial development. Delayed closure may indicate conditions like hydrocephalus or hypothyroidism per pediatric growth standards. 2. A 2-year-old should be able to ride a tricycle independently. True or false? Answer: false. Rationale: a 2-year-old may begin pedaling a tricycle but typically achieves independent riding by age 3 per gross motor development milestones. 3. Breast milk is the recommended primary nutrition source for infants up to 6 months. True or false? Answer: true. Rationale: the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months due to its nutritional and immunological benefits, supporting optimal infant growth. 4. The MMR vaccine is administered to infants at 6 months of age. True or false? Answer: false. Rationale: the MMR vaccine is given at 12 to 15 months for the first dose, as earlier administration may be less effective due to maternal antibodies, per CDC immunization schedules. 5. A normal heart rate for a newborn is 120 to 160 beats per minute at rest. True or false? Answer: true. Rationale: a newborn's heart rate ranges from 120 to 160 beats per minute at rest, reflecting their higher metabolic rate, per pediatric vital sign norms. 6. Parents should be excluded from the room during pediatric pain assessments. True or false? Answer: false. Rationale: family-centered care encourages parental presence during pain assessments to provide comfort and assist in interpreting the child's responses per pediatric nursing standards. 7. Car seats should be rear-facing for children under 2 years of age. True or false? Answer: true. Rationale: rear-facing car seats protect the head and neck of children under 2, reducing injury risk in crashes, per American Academy of Pediatrics safety guidelines. 8. Neonates require vitamin K supplementation at birth to prevent bleeding disorders. True or false? Answer: true. Rationale: neonates have low vitamin K levels, increasing the risk of hemorrhagic disease. A single intramuscular dose at birth prevents this, per neonatal care protocols. 9. The Flack scale is used to assess pain in adolescents. True or false? Answer: false. Rationale: the Flack scale is designed for nonverbal children, e.g., infants, toddlers, while adolescents use self-report scales like the numeric rating scale, per pediatric pain assessment guidelines. 10. Nurses can administer medications to a child without parental consent in emergencies. True or false? Answer: true. Rationale: in life-threatening emergencies, nurses can administer medications to save a child's life without immediate parental consent, per legal and ethical pediatric standards. 11. A 4-year-old should be able to count to 20. True or false? Answer: true. Rationale: by age 4, children typically can count to 20, reflecting cognitive and language development, per preschool developmental milestones. 12. Cow's milk is recommended for infants under 12 months. True or false? Answer: false. Rationale: cow's milk lacks adequate iron and nutrients for infants under 12 months and may cause gastrointestinal issues, per pediatric nutrition guidelines. 13. The DTaP vaccine protects against diphtheria, tetanus, and pertussis. True or false? Answer: true. Rationale: the DTaP vaccine immunizes against diphtheria, tetanus, and pertussis, administered in a series starting at 2 months, per CDC immunization schedules. 14. A normal respiratory rate for a 5-year-old is 40 to 60 breaths per minute. True or false? Answer: false. Rationale: a 5-year-old's normal respiratory rate is 20 to 30 breaths per minute at rest, slower than infants due to maturing lung function, per pediatric vital sign norms. 15. Family-centered care includes involving parents in care planning. True or false? Answer: true. Rationale: family-centered care emphasizes collaboration with parents in care planning to meet the child's physical and emotional needs, per pediatric nursing principles. 16. Bicycle helmets are unnecessary for children under 5 years. True or false? Answer: false. Rationale: bicycle helmets are critical for children of all ages, including those under 5, to prevent head injuries per pediatric safety guidelines. 17. APGAR scores assess a neonate's neurological status at birth. True or false? Answer: true. Rationale: the APGAR score evaluates a neonate's heart rate, respiration, muscle tone, reflex, and color at 1 and 5 minutes post-birth, reflecting neurological and overall status, per neonatal assessment standards. 18. Adolescents should be screened for scoliosis annually. True or false? Answer: true. Rationale: annual scoliosis screening during adolescence detects spinal curvature early, allowing for interventions like bracing, per American Academy of Pediatrics guidelines. 19. Acetaminophen is safe for pain management in neonates. True or false? Answer: true. Rationale: acetaminophen is safe for neonates when dosed correctly, e.g., 10 to 15 mg/kg, commonly used for mild pain or fever, per pediatric pharmacology guidelines. 20. Nurses can share a child's medical information with teachers without parental consent. True or false? Answer: false. Rationale: sharing a child's medical information requires parental consent under HIPAA to protect privacy, except in emergencies, per legal standards. 21. A 6-month-old should be able to sit without support. True or false? Answer: true. Rationale: by 6 months, infants typically sit without support, reflecting gross motor development, per infant developmental milestones. 22. Iron-fortified formula is unnecessary for breastfed infants. True or false? Answer: false. Rationale: breastfed infants require iron supplementation, e.g., drops, after 4 to 6 months to prevent anemia, as breast milk is low in iron, per pediatric nutrition guidelines. 23. The varicella vaccine is given to prevent chickenpox. True or false? Answer: true. Rationale: the varicella vaccine prevents chickenpox, administered at 12 to 15 months for the first dose, per CDC immunization schedules. 24. A blood pressure reading is required for routine newborn assessments. True or false? Answer: false. Rationale: blood pressure is not routinely measured in healthy newborns unless clinically indicated, e.g., congenital heart defects, per neonatal assessment protocols. 25. Siblings should be included in family-centered care discussions. True or false? Answer: true. Rationale: including siblings in age-appropriate discussions fosters family support and reduces anxiety, aligning with family-centered care principles, per pediatric nursing standards. 26. Choking hazards are a concern only for infants. True or false? Answer: false. Rationale: choking hazards are a concern for infants and young children, e.g., toddlers, preschoolers, due to small airways and exploratory behavior, per pediatric safety guidelines. 27. The rooting reflex in neonates disappears by 6 months. True or false? Answer: true. Rationale: the rooting reflex, aiding breastfeeding, typically disappears by 4 to 6 months as voluntary feeding develops, per neonatal developmental milestones. 28. Adolescents require the same medication dosages as adults. True or false? Answer: false. Rationale: adolescents require weight-based or age-adjusted medication dosages due to differences in metabolism and body composition, per pediatric pharmacology principles. 29. The Wong-Baker-Faces scale is appropriate for pain assessment in toddlers. True or false? Answer: true. Rationale: the Wong-Baker-Faces scale is suitable for children as young as 3 who can identify facial expressions, aiding pain assessment in toddlers, per pediatric pain guidelines. 30. Nurses can override parental refusal of vaccinations for a child. True or false? Answer: false. Rationale: parental refusal of vaccinations must be respected unless court-ordered, with nurses providing education to address concerns, per legal and ethical standards. 31. A 3-year-old should be able to draw a circle. True or false? Answer: true. Rationale. By age 3, children typically can draw a circle, reflecting fine motor and cognitive development per preschool developmental milestones. 32. Formula-fed infants require fluoride supplements at birth. True or false? Answer: false. Rationale. Fluoride supplements are not recommended until 6 months for infants in areas with low water fluoridation per pediatric dental guidelines. 33. The hepatitis B vaccine is administered at birth. True or false? Answer: true. Rationale. The first dose of the hepatitis B vaccine is given within 24 hours of birth to prevent perinatal transmission, per CDC immunization schedules. 34. A normal temperature for a toddler is 38.5 degrees Celsius. True or false? Answer: false. Rationale. A toddler's normal temperature is 36.6 to 38 degrees Celsius. 38.5 degrees Celsius indicates fever, requiring assessment per pediatric vital sign norms. 35. Play therapy is an effective psychosocial intervention for hospitalized children. True or false? Answer: true. Rationale. Play therapy reduces stress and promotes coping in hospitalized children, supporting emotional well-being per pediatric psychosocial care principles. 36. Window locks are unnecessary for homes with school-age children. True or false? Answer: false. Rationale. Window locks prevent falls in homes with school-age children who may be curious and active, per pediatric safety guidelines. 37. Neonates should be bathed daily to maintain hygiene. True or false? Answer: false. Rationale. Neonates require sponge baths 2 to 3 times per week to avoid skin dryness and maintain temperature, per neonatal care protocols. 38. Adolescents should be screened for depression during well-child visits. True or false? Answer: true. Rationale. Depression screening during adolescent well-child visits identifies mental health issues early, per American Academy of Pediatrics guidelines. 39. Ibuprofen is contraindicated in children under 6 months. True or false? Answer: true. Rationale. Ibuprofen is not recommended for infants under 6 months due to immature renal function, with acetaminophen preferred, per pediatric pharmacology guidelines. 40. Nurses must report suspected child abuse to authorities. True or false? Answer: true. Rationale. Nurses are mandated reporters and must report suspected child abuse to protect the child, per legal and ethical pediatric standards.